What happened? He had like a new movie?
Bill Nye's Earth Day musical.
Oh. Hi, I'm Dr. Gary Motykie, and I am a Beverly Hills board-certified plastic surgeon. And today I wanted to talk about Zac Efron because there's been a lot of hype recently about a photo that was posted of him online and some of the changes that we're seeing in his face. And whether those are real or not, I think there's some important points that we made either way. But if it is a real photo, then we definitely have some stuff to talk about. If we're looking at, I think what happened with somebody like Zac is he's kind of the epitome or poster child for, male attractiveness and masculinity, and so when something changes about his face, people are going to notice. And I think when the changes aren't great, they notice even more. So if we look at Zac before this photo, he has features that are kind of the time, like I said, the time-tested epitome of a male, masculine, attractive face. With his eyes, he has those hunter eyes, that expression of masculinity, alpha male, that sort of a thing. As well as his chiseled kind of masculine look, high cheekbones, nice strong jawline, kind of weird scruff. All those things are giving the immediate appearance of a strong masculine male. If you change that, people are going to notice. So the first thing we notice from one of Zac's old photos to this new photo, if it's real, is that he looks much more feminine, and that's breaking the golden rule. So there's two things you never want to do in plastic surgery. That's make things look worse or weird or strange, or taking somebody, and particularly a male, and making them look feminine, or a female and making her look masculine, unless that's what they want. Because otherwise it's going to become very confusing and strange and weird and androgynous, and your eyes like, what's going on here? And so when I'm looking at his new face, starting with his eyes, he's changed that kind of stern, masculine prey look to this kind of soft, kind of surprised look to his eyes. Something's changed there. Now, that can come from Botox to the brow, just things changing in general. Something's happened there. I will say overall, I want to make a point about his face, is it's poofy. It's fuller. He's lost that chiseled look. All of these things, again, more to a feminine, oval-shaped, softer face, which is going to make him look more feminine. Then on top of it, we notice something's different about his lips. So we move down to his lips, and men generally don't get fuller lips on their own. Again, something that's going to make him appear more feminine. So we're doing all of these things. The eyes have changed, the cheeks have gotten poofier, the chiseled lip has gone, the lips have gotten fuller. These all make him look more feminine, less masculine. And then one other thing in that photo is he's shaved a little bit more of his scruff off. So on top of everything else, he's taken away from that masculine look and the slight beard he'd have. That's gone. The lips are fuller. The eyes are different. Now we're looking at him going, something's different. He looks feminine and poofy and weird. So I'm not picking on him. But if that's a real photo, that's what everybody's kind of up in arms about. And I think in general, men need to be careful of that. So that's the point I want to make. Whether this photo is real or not, this is a big no-no in the world of plastic surgery or just aesthetics in general, that the opposite would be better. In other words, more chiseled, a little bit of scruff, more of that stern look to the eyes, not a soft, rounded brow. All those things will make you appear more masculine rather than feminine. One other thing I wanted to say about the face is it's attached to the body. What I mean by that with Zac is that he's gone through some transformations. He when he was doing this Baywatch role, he really cut weight, got ripped up, and that again leads to a much more chiseled look in the face, a more masculine look. And then now, moving into this photo, he's kind of lost that chiseled masculine look. Now that can just be effect of gaining some weight. It could be a change in his body. Also, sometimes guys will play around with different things as far as hormones or steroids or things that can make the face appear more bloated. So there are things that could be changing in his personal life, with his body type, with his weight, different sorts of things that when you mess with your body can mess with your face. In addition to if something was done as far as fillers, which I'm suspicious if that's a real photo, that either Botox was done to his brow, fillers was done to his mid-face and his cheeks and his lips. So I think there may be a combination of those things if the photo is real, but all of those things have led to him looking, like I said, softer and more feminine and not masculine. In the bigger picture, if you want to reverse those things, they are. The good news is it's probably reversible. He can, dissolve the fillers, go back to, a better routine as far as workouts, losing some of the, if he did gain weight, cutting back on any sort of use of things that can make you appear bloated and fuller. So I think combination of all those things could change his look back to where he was without much harm. It's something I would advise him if he wanted to go back. If you're male, go to somebody who's experienced in doing male, procedures on you so that you'll appear more masculine and more attractive and not more feminine, strange, weird, or androgynous.
Some people are curious about a chin implant.
I'm curious about his jawline because it's one thing we didn't quite touch on, but because he's shaved between the two, there is definitely some difference there. And, a lot of men use a beard or scruff to hide things. I do think in that new photo that his jawline appears augmented in the mandibular area, as well as the chin being slightly more pronounced. So there is some possibility there that he has done fillers or some augmentation to that area. I'm a little suspicious of that, but overall the entire face is a little bloated, so it's hard to say, but I do notice something there. A chin implant would probably be unlikely because he really didn't need one. So that's my analysis of the current situation with Zac, if that's the real photo. If you have any questions, please leave them in the comments below.